Have a good day, dear participants. As all of you know, we are continuing with a 12-week course for integrative approach in palliative care for the chronically ill patients. And we have covered a bit of the syllabus. And now, for the last 2 days, we are focusing on the symptoms management. Because most of the chronic diseases in the elderly people, mainly, they get many kinds of symptoms, especially in the cancer patients and others also. And that symptom management is very important, because that is the point which gives you a kind of contentment that improves your quality of life. You know, the quality of life means mind-body balance. So mind is under stress because your symptom is not under control. So we control the symptom, your mind gets relaxed, and that relaxation gives a kind of happiness to the patient. And that is the main goal in the palliative care. What are the 4 goals? Pain management, gastric problems, appetite, sleep, and happiness. These are the 4 goals your patient should have. How to do it? So we are now focusing in the symptom management. And today I am going to talk about intestinal obstruction in palliative care, causes, management, and integrative approach. Intestinal obstruction occurs when food, fluid, and gas cannot pass through the intestine. In palliative care, surgery is often not an option. I mean, if it is in that end of life stage or before that, surgery is not recommended. So non-surgical management is a big challenge, but that is the only option. So management focus on symptom relief and quality of life. This picture shows what is the obstruction. This is a cancerous obstruction. This is a large intestine, this is a small intestine, this is a rectum. But a cancerous tumor has developed here, which is not allowing the fecal part to go out of the body. That is the main problem. So how to manage it? Relevance to the palliative care. The malignant bowel obstruction, MBO, is common in advanced cancer stage. What are the key symptoms here? Abdominal pain, nausea and vomiting, abdominal distension, and inability to pass stool. When stool will not pass, there will be distension in your stomach. The abdominal distension means belly will be full of gas, and that will induce nausea and vomiting, and ultimately there will be pain. So everything is linked to the inability to pass the stool. What should be the focus? To manage how stool can be passed even there is obstruction which is not able to surgically remove. So this is our goal. And the goal is relief from the distressing symptom. These are the symptoms, not curative treatment, because we are not going to remove the tumor by surgical method, but how to manage his distress. It's very challenging. These are the signs of complete small bowel obstruction. There can be peritonitis, means there can be leakage in the intestine and the food material can leak into the peritoneum, which is very dangerous and very toxic. It should not be there. Distended, rigid abdomen. Abdomen is so hard and full of gas, very difficult to tolerate. Guarding, hypotension, tachycardia, fever, and shortness of breath. These are the signs of complete small bowel obstruction. And this is the sign of cancer, tumor related obstruction. How it happens? What are the common causes? You see, hernia, adhesions, आंत चिपक गई है, यहाँ आंत निकल गई बाहर. Tumor cancer. A tumor has been developed in your intestine, which is blocking the passage. Intrusification. Volubles, क्या कहते हैं उसको, ऐठ गई है. Intestine has been wrapped on each other, and foreign obstruction, something you have eaten which has not been digested and it has blocked your intestine. These are the common symptoms when you get obstruction in your small intestine or large intestine. Mostly the large intestine is the more problematic because the stool is collected here and that is toxic also. So tumor growth compressing the intestine, post-radiation, fibrosis. Fibrosis means already the intestinal cell wall, which is supposed to, elasticity is there, that has been lost. And chronic paralytic ileus. There is a kind of neural paralysis. Paralysis means a neural disease when the nervous system is not able to control your peristaltic movement. That is called the paralysis in the ileum. Recurrent adhesion after surgery, adhesions and lymph node obstruction. They are the common causes which you can see in this picture. Now, the comparison of intestinal obstruction versus constipation. I mean, stool will not pass in the obstruction also, and stool will not pass in the constipation also. But how you will differentiate it? It is very important because you are the caregiver and you have to refer your patient to the appropriate physician. But how you will diagnose, how you will tell? Cause, symptoms, vomiting and treatment. Cause is the intestinal obstruction, blockage in preventing passage. This is the slow stool movement. Constipation is the slow stool movement. It becomes hard, it not passes out. This is constipation. Obstruction means preventing the passage. Something has been blocked. These are the things which are blocking the intestine. So your food, your stool is not passing. And here there is no blockage, but still the stool is not passing because it has become hard or some problem is there. Pain, vomiting and distension. Distension is there. Hard stool and blotting. This is the common symptom of constipation. And this is the vomiting is very common because everything has been stuck here. Here it is rare. You will have hard stool, blotting, you will but not the vomiting, which is common, which is not there. And treatment, which is a medical emergency because obstruction has to be removed by some way, whatever is possible. Surgically it is not possible, but even then something has to be done. Here the diet and laxatives can help. The intestinal obstruction is something physically has thing happened in your intestine that has to be removed. The Ayurvedic management, but that is very challenging because earlier I have told you that the patient is not able to go for surgery, but non-surgical appliances have to be applied so that the patient can get relief and blockage can be removed. Ayurvedic management of intestinal obstruction. So, Triphala churn, ginger tea, aloe vera juice, fennel and ajwain seeds. These things are also used in constipation and in obstruction because these are the only helping in symptom management. What is the symptom? Hard stool, gas is not passing. So in Ayurveda, the principle is that if your digestion is not proper, constipation will happen. And here the obstruction is there. The obstruction removal is a great challenge. Something has to be done by the medical people. But even then, if the obstruction is there, even then the patient is able to pass stool by some difficulty, but not 100% obstruction. Suppose there is 60% obstruction, the 40% is there. We are focusing on that 40% part of passage of stool. So for that, digestion is very important. Laxatives are very important. Harit ki churn and trikatu. Trikatu is important for digestion. Harit ki churn for laxative, it acts as laxative, and this is also for digestion. And aloe vera, ginger tea, triphala, all these things are helping your GIT. In Ayurveda we call Jatragni. Jatragni has to be strong by using these. In homeopathy also there are some medicines like Naxwamika 30, Lycopodium, Plumbum Metallicum 30, opium therapy. These are the medicines, they are acting on your nervous system, and through the nervous system, they are managing your intestinal movement and your bowel. So you can see it is written spasmodic pain and nausea, gas distension and incomplete evacuation by lycopodium, paralytic ileus, no stool or gas passage, this medicine, and opium, severe blotting and no peristaltic movement. So naturopathy is also may be helpful. Abdominal massage, circular movement on relieving your discomfort. Hot and cold patti is very, very effective in that. Mitti lep, mud therapy on abdomen, and basti is the enema, medicated enema. And deep breathing, because you are feeling restless, so we have to relax. The parasympathetic nervous system should be activated. Then only you will feel relaxation. Your vagus nerve should be activated. For that, deep breathing is very effective exercise. It reduces the stress, support the gut infection. You see, if you take a deep breath in any problem, you feel kind of relaxation. The same thing is we are recommending here, because we are trying our best, but unless and until you are relaxed, stool will not pass. So relaxation is very important for passing your stool. You have the deep breathing we are recommending. And this is Chinese medicine, acupuncture and acupressure. And these are the traditional Chinese system of medicine. In India also, there are many practitioners that are doing it, but it is not the Ayurveda. Nutritional considerations recommended: soft and blended food. Avoid raw vegetables, high fiber foods, because already you are having constipation, blockage like thing. If you are taking more fiber, it will aggravate your problem. So the liquid diet, that's why we recommend. Clear broth and soup, this is liquid diet. And carbonated drinks is not recommended. Hydration, water and coconut water. As much as you can, water you should face. Fried and spicy foods are not recommended. And small, frequent meals. Don't take in the normal person take two meals in a day, lunch and dinner. Then he is good. But he is a patient. For him, this philosophy will not work. He can take a small amount of food frequently, so that digestion can be proper and passing a stool can be in a small amount. This is a very important theory. When to consider palliative surgery indications: localized obstruction, as I showed you, the cancer tumor is there, localized obstruction with good prognosis. Then we go for surgical. Non-malignant, reversible causes. Suppose that the intestine has come out like hernia, or it has strangled on each other, because intestine is very big. Then we can have surgical operation, or there is a peritoneal leakage has come, we have to operate. There is no way. And the contraindication: widespread disease with poor survival, frailty, high surgical risk is there. Many patients are in the end of their life. They are not able to tolerate the anesthesia and surgery. That's why we don't do it. Role of palliative care team: holistic approach, pain relief, nutrition planning, psychological support, as I told you, and advanced care planning. Depending on the condition of the patient, plan it. This is slide showing the mechanism of pain induction. Simple obstruction, lumen distension, high amplitude, intraluminal pressure goes high, stimulation of mechanico-sensitive receptors on afferent nerve, and acute abdominal pain. I mean, pain you find, but there is a big mechanism, biochemical and physiological mechanism. So if you do intervention at any of these steps, pain management will be there. This is a closed loop obstruction. This is a ischemia, hypoxia, low pH, inflammatory mediators, and stimulation of chemical receptors on afferent nerve. So I want to emphasize through this slide, as a physician, we have to understand what is the most prominent mechanism which is affecting the pain in that patient. So if we give that kind of medication, he will get better relief. Psychological and emotional support, anxiety from nausea, vomiting and pain. This is the most important we have to manage. And counseling for patient and caregiver, because the patient and caregiver both should be given counseling that look, we are trying our best, don't worry, don't go under anxiety. We have to talk to them, we have to divert their mind from their problem to other part of their environment. Then only the anxiety will come down. Creating a comfortable, stress-free environment. This, how you will do it is by talking to them, by diverting their mind from their problem. So, tips to relieve bowel obstruction. Cut a lemon and smell it. Try some honey water to make mouth less dry. Massage the abdomen. Frequent meal that I told you. Take a few mouthful of Coke can relieve a gassy feeling, because you know the carbonated, I have told you carbonated liquid is not good, but a small amount can help this for that particular time. But regular taking is not recommended. Go for a short walk. If a patient can walk, he is able to get up and walk down, he should be allowed to, he should be motivated to walk. And try sweet ginger soups, Why sweet? Sweet is a very good to increase the movement, intestinal movement. That's why when laxatives are given, we always recommend to have sweet. In the night time also, milk, sweet milk before bedtime is very good, because it helps a good sleep, number one, and it also helps the good bowel in the morning. So sweet is very important. Interestingly, I have observed that most of the diabetic patients, they distance themselves from the sweet, and because of that, they mostly develop constipation. I mean, this is a paradox. You are a diabetes, you should not take sweet, but if you are not taking sweet, you are getting into constipation. So some balance has to be made, and it is important is the caregiver should know how much balance, how much sweet can be given to a diabetic patient under chronically ill condition, because sugar should not go high, but at the same time, intestinal movement should also be maintained. So, emergency consideration, signs complete, severe pain, no passage of stool or gas, a lot of distension, persistent vomiting, then you have to complete obstruction. This is a sign of complete obstruction. You have to go to the hospital, you have to take care. Bowel ischemia, risk of complication, bowel ischemia, perforation. Perforation means intestine has broken down and food has come out in the paper. And sepsis, septicemia will take place. If there is perforation, it is not controlled, septicemia will occur, the multi-organ failure, patient will die. So you have to be very careful on that condition. So malignant bowel obstruction, I have told you, seen in the colorectal, ovarian and gastric cancer. Peritoneal metastasis can lead to fibrosis and blockage. Recurrent obstruction may not benefit from the repeated surgery. Recurrent obstruction is, if it is happening, surgery will not. How many times you will go for surgery? One time you can go, but always you cannot go. This is the, when a patient is very serious ill, medical management, non-surgical, this is called the nasogastric tube. This is the nasogastric tube, or venting, gastrostomy, reduces the pressure and vomiting. Pain management, opiates like morphine, fentanyl, antispasmodic, hyoscine, and octreotide reduces the intestinal secretion. These are the medicines, okay? And corticosteroids are all, reduces the inflammation. And parenteral nutrition, TPN, this is the TPN, through bottle. Nutrition is required. Either it can be go your nose, or it can be go your mouth, or it can be go your veins. So these are the different places where food can be given when you are in the very chronic condition. So common myth about the intestinal obstruction. All obstructions require surgery. This is the myth. Many can be managed conservatively, means non-surgical. Laxatives can resolve an obstruction. Laxatives are not safe in true obstruction. Remember, laxatives are good for constipation, but not for the obstruction. Diet has no impact on obstruction. Careful diet planning. I mean, the contraindicator, I told you the Coca-Cola is not good for your patient, but a small amount can help him, can relieve the gas. This kind of. So, careful diet planning, depending on the situation, helps to reduce symptoms. So, takeaway message is that intestinal obstruction is common in palliative patients. Management focus on symptom relief over curative treatment. Integrative approach like Ayurveda, homeopathy, naturopathy can help when it is combined with allopathic treatment, and emergency cases require hospitalization. So caregiver, all of you are going to be a trained palliative care caregiver. You should keep in mind when you should refer your patient to the hospital. Very important. And this all course is only to make you aware your limitations and your potentials. So case study discussion, a palliative patient with ovarian cancer develops a recurrent intestinal obstruction. The question is, how would you manage this case as a palliative caregiver? What integrative approach can help? You have to give a patient-centric model for his quality of life improvement. What you will do? So you have to plan accordingly, and you have to answer it on this classroom link. You have open it, and there are two sections. One is the question MCQ, and one is the discussion forum. In both there is some assignment for you. You can do it. What are the first line of treatment for malignant bowel obstruction? Which Ayurvedic remedy is best for bloating relief? I told you ajwain and all these things, tripla, haritki, they are helpful in this. How can palliative care team improve the patient comfort? First of thing, try to stimulate his parasympathetic nervous system. And what are the tools? We have already discussed, and now you have to read and write in this forum. And you know, when you are discussing in forum, there is a you have to make a comment of your colleagues who have also put their idea, positive comments. Okay, you have to criticize positively, like a group discussion. Okay, how things will be best. With this, I end my lecture. So thank you very much for your patient listening.